Good afternoon and welcome, everybody. My name's Lagacé Dowson, with a bit of a cold, sorry. I'm the host of the webinar and the communications director of the Canadian Health Coalition, which, just as a reminder, was founded in 1979 to protect and advance healthcare. Our members are frontline healthcare workers, civil society groups, researchers, students, faith-based groups, and individuals who are committed to public universal healthcare in Canada. Today I'm speaking to you from Jojage, or Montreal, on the unceded territory of the Ganyankahaka of the Haudenosaunee, the Mohawks of the Six Nations Federation. Bienvenue à toutes et à tous. Ce webinaire se déroulera en anglais, mais nous pourrons prendre des questions en français dans le Q&A. Alors, bienvenue à tous. So today's webinar, I think it's maybe the fourth that we've done with our guest, who's a great favorite of ours. Today's webinar is entitled Putting Teeth in Healthcare This Election with Dr. Brandon Doucet, who is the foremost public dental care champion in Canada. I think it's safe to say that. He's a practicing dentist and author in Halifax. And I just wanted to mention and give a shout out to his book, which is entitled About Canada Dental Care, which is published by Fernwood. It costs $20 and there's a reduced rate for students, so I highly recommend it. It's a small compendium, but it has some pretty staggering statistics in it, and also the history of how private interests have tried to derail dental care since the beginning of healthcare. So the Canadian Dental Care Plan, the CDCP, is now in effect. And as of May, 18 to 64-year-olds are supposed to be able to sign on as long as their incomes don't exceed 90,000. And I'll let Brandon tackle some of the numbers because a lot of people have signed on. It turns out roughly 1 in 4 Canadians is eligible, and far from that number have signed on so far. But it is, I think, safe to say it is the beginnings of a real success story in terms of covering health, oral health, which has been, fallen off the radar. So Brandon joins us now from Halifax, and I'm just going to say, well, just to jump right on in there, Dr. Doucet.
Thank you, Anne, for the introduction. And yeah, I would like to start this by giving the definition of oral health from the World Dental Federation. And they state that oral health is multifaceted and includes the ability to speak, smile, smell, taste, touch, chew, swallow, and convey a range of emotions through facial expressions with confidence and without pain, discomfort, and disease of the craniofacial complex. So clearly, oral health has much more to do than just the perfect smile. Poor oral health has been shown to worsen type 2 diabetes, heart disease, and aspiration pneumonia. And a dental abscess can lead to potentially life-threatening infections. And poor oral health, lacking access to dental care, it contributes to the cycle of poverty because having missing front teeth or visible decay can affect employability. Considering the impacts of poor oral health and the importance of access to dental care, I think it's fair to say that we should consider dental care as health care. And we have universal health care here in Canada. So I think it's important we contextualize how our current dental care system, and this would be before and now with the Canadian Dental Care Plan, is inconsistent with the Canada Health Act's mission to protect, promote, and restore the physical and mental well-being of residents of Canada, and to facilitate reasonable access to health services without financial or other barriers. And I'm going to refer to the Canadian Dental Care Plan as the CDCP, just abbreviated. So before the CDCP, we had 1 in 3 Canadians that had no dental insurance, and over 1 in 5 avoided the dentist each year because of financial constraints, with the last few decades showing trends towards decreasing access to dental care because the rate of unionization has decreased over the last few decades and the rise of the gig economy, meaning that many workplaces are not providing benefits like dental insurance tied to their labor. And at the same time, many older people are retiring and losing their workplace benefits. At the same time, we've also seen dental fees, for example, in Ontario, rise at twice the rate of inflation between 2001 and 2021. And in the same time frame, even extending from, say, the 1980s to 2021 or so, we've seen the social safety net for dental care in Canada be eroded as well. Because in 1980, public dental spending accounted for 20% of overall dental spending, but this has been chipped away at to its current rate of about 6% before the CDCP. This erosion of dental programs is because of the political weakness of targeted programs in comparison to universal programs. And by targeted, I mean that not everyone is covered, which creates a window of opportunity for politicians to exploit, where some segments of the population feel resentment towards paying into a program through their taxes but not receiving any benefits. And rather than politicians offering to get around this by making the program universal, they rather demonize the people eligible for the program in order to justify restricting access to the program, and it works. Targeted programs across the entire social safety net have been chipped away at with this strategy. And with respect to public dental programs, we've seen programs that were once for all children being restricted to just low income children, coverage being cut to only cover extractions rather than preventative and early intervention services, and income cutoffs and fees the programs pay out get de-indexed from inflation.
So
Just
Brandon, if I can just jump in, this question of universality is a key point because it has come up, or its absence has come up in the election campaign. Even the NDP doesn't seem to be hewing to the idea of universality. So I wonder if we could just review what it means and why you think it's important, or why it's viewed as important with regard to social programs such as dental care.
For sure. Obviously, universality means covering everyone in the country. There's some problems with that with their universal health care when it comes to migrant workers, but the idea is obviously people aren't falling through the cracks between the public social safety net that we have and the private network of people getting insurance with the private sector. There's not a gap where people either don't have insurance or they have insurance that's really bad and they can't actually use it. So trying to make sure there's no gaps there, but also from a political standpoint as well. When everyone is buying into a program, cuts to that program is seen as an attack on the society as a whole, not just as I said, targeted programs. It's tend to be seen as for those people per se, which is something that politicians can
Like a
demonize.
charity model, like the
Exactly. Like you should be grateful for what you're having rather than you're entitled to this. This is a right, like dental care is healthcare, and you are entitled to it.
So and also when we say universality, we mean everybody's covered, and those people who we correct any imbalances in terms of spending through the tax system. So we don't we're trying to maintain a sort of equity with regard to the spending. And I think that's a part that sometimes is missing when people say, "Oh, you guys, you're naive, you think a universal program is a good idea," and the part about correcting it in taxation isn't clear enough, I think. I wonder if you could touch on that.
Oh, totally. And that was actually the name of one of the first series I did on this subject was Taking a Bite Out of Inequality, the case for universal dental care. And it was something that, you know, to give perspective, we have some of the highest dental costs in the world. I don't have the exact numbers off the top of my head, but I think it's just the US and maybe one other country that has higher dental costs per capita than we do. And it's something that we don't get great results for this because, as I said, under a private system in Ontario, for example, they've risen dental fees at twice the rate of inflation. Dentists can charge above and beyond that. Whereas with a universal system, you're able to contain those fees so that they don't go above and beyond inflation. With the tax system as well, you can also shift the burden of the cost of dental care onto the wealthy. So while you might be paying, let's say, $700-800 per year for dental care now, whether that's through private insurance or even taxes for a public dental program that covers some people but not everyone, and then your out-of-pocket expenses as well. With a universal system, we could shift it so that you only pay $200 and someone who's wealthy might pay $2,500.
Hmm.
And that's a fundamental shift when you have a universal program that you can do that. That's much harder to do with targeted programs. It's hard to do, and it was just when the private sector is at the heart of things, you can't do that. And also keep in mind the people who have the highest dental needs often have the least access to dental care, meaning that their dental costs would be even higher because they have, you know what I mean? It's harder for them to eat healthy foods. Maybe they didn't have adequate education on the subject when they were younger as well. So they have worse oral health outcomes. And
So I'm just going to interject now to remind people to take a look in the chat because my colleague Tracy Glynn, who is the Director of Operations at the Canadian Health Coalition, has put in some suggestions. If you want to follow Brandon on Dentalcare, you can find him on Facebook and also on Instagram. And there's information about how to get a copy of his book, which is like a fairly small little compendium of the history of dental care. It's mixed for an easy and very important read. So there's information for you in the chat. And for those people who have a question or a comment or an observation about what they're seeing about dental care in their own lives and amongst people around them, please jump on to the Q&A and we'll try and bundle questions and hand them over to Brandon to try and address them. Because I'm sure that many of you have thoughts and observations on this, I think, really wonderful program. Flawed as it may be, it's a huge step forward for a lot of people. So do jump into the Q&A and ask your questions. So just to go back to the federal government, the federal campaign, which is winding down in just a few days from now, like we have like 6 more days of campaigning. We know we did a survey here at the Canadian Health Coalition and we asked people what they thought about the program. And we found, this was done last summer, 63% of people who identified as conservatives support pharmacare, and a great many of them support dental care. So it crosses ideological lines. These programs are not, you wouldn't think they would, but they do. And I wondered if you wanted to address the fact that Pierre Poilievre has even said that he's in favor of dental care, kind of. And Carney has said that, Mark Carney, leading the Liberal Party and the acting Prime Minister, has said that he's prepared to stick with it and even advance it. I wonder if you could give us your sort of global assessment of how the parties are handling this issue.
for sure. I think with respect to Polyev saying, he basically said that anyone who has coverage won't lose it, which if we contextualize this, the Liberals backed away from their promise of fully implementing the Canadian Dental Care Plan before the next election and left the largest cohort to be eligible for just after the election. So currently, about 3.5 million out of the 8.5 million eligible Canadians are signed up for the Canadian Dental Care Plan, with that last and largest cohort in the 18 to 64 category who do not meet who don't have private insurance and the other criteria. So that last 4.5 or so million people won't be eligible until after the election, which is something that Poilievre's saying nobody who has coverage will lose it, raises the big question mark of what about those remaining 4.5 million people, that largest cohort of people who aren't currently signed up for the program, so they don't currently have coverage to lose, but they were promised this and they're going to get it shortly after the election. Keep in mind that Poilievre was denying the existence of this program up and until he blew a 10-point lead in the polls, and now he's trying to distance himself from a fascist mega movement south of the border that he's cozied up to for years. So I would take his words with a big grain of salt there. With respect to the Liberals themselves and Mark Carney, I think with a Liberal majority, I think there's a good chance we'll see the last phase of this program be implemented as it was promised, and they'll follow through with that. But we've already seen some pretty major cracks in the Liberals' commitment to this public dental program. First and foremost being that the income cutoffs for the program have not gone up with inflation each year, meaning that people are either losing cover. Like if inflation goes up a little bit and then that your purchasing power is still the same from one year to the next, and those income cutoffs don't go up, you're effectively lowering the limits for that program. And it's something that people are either losing coverage for one or getting bumped into one of the categories that have much higher copayments. So you might go from having, a 15% copay to like a 50% copay. And that's something that was also a big problem with respect to the Liberals following through with their commitments, in that they originally promised a program that had no co-payments for those making less than $70,000 per year. And because they allowed dentists to balance bill, which is to charge the fee difference between the CDCP fee guide and the whatever dentist normal fees are, this has created about a 15% copay that they originally told people that they weren't going to have. And this is something that um, they managed to do that even during a Liberal NDP minority parliament. So if they have no one holding them accountable, I think we should be questioning their desire to go for. I wouldn't expect them to go any further. Now, with respect to the NDP in this campaign, there has been some questions over their stance on where do we go from here. Um, and there's been some vagueness to their responses, but also at the same time, we do have strong MPs like Don Davies, who I've done a lot of work with, who has long held the position that basically the Canadian dental care plan needs to be seen as a down payment towards a universal dental care system. And that we know with universal health care that it's taken over 10 years to achieve. And this can be potentially step one in that process for dental care. And considering we would not have the Canadian dental care plan if it wasn't for the NDP holding the balance of power in a minority parliament, I think there's a very strong case that keeping a minority parliament with their president is very much necessary and essential. And I don't think, we as progressives, we have two goals in this election. One of them is to keep Pierre Poilievre out of power. And the second one should be to stop Mark Carney from having a majority government. And I don't think that those conflict with each other like many in the media are acting like it does. Because, I mean, there was a recent article came out from Christo Avalis, who does a lot of Canadian politics stuff and Canadian Dimension, that basically laid out, I believe there's 97 districts here in Canada where basically I think there's around 25 where the NDP are the front runner against the Conservatives, and then another 70 or so where the Conservatives have no chance in winning. So in those districts, there's no potential idea of vote splitting causing the conservative, and oftentimes vote splitting is synonymous with voting liberal. There are districts where voting NDP is the strategic choice or does not lead to the conservatives coming to power. So I think focusing on those districts and getting NDP MPs or Green MPs, if they're whoever's the progressive front runner there, is our best chance at continuing to make progress on this issue.
So we have some pickup in the Q&A. I just remind people to take a look at the chat as well. There's some constructive suggestions as to where you can get more information. But I'll just start with the Q&A, starting with Ruth Jones, who says her husband was ill and housebound in a home, in a hospital bed. There were no dentists who did home visits, but hygienists do. So we could maybe touch on the question of hygienists. Here's a really poignant anecdote from Isabel Emery, who says a guy that she knows in her neighborhood has terrible teeth, rotten and broken teeth, and he knows they're negatively affecting his health. She directed him to a clinic which would treat him based on his income, but he's nervous. He went to a similar clinic. He got charged more money than he could afford, $500. And so this is a person who lives in Danielle Smith's Alberta, and Isabel Emery wants to know whether he would be eligible for the federal program. He does odd jobs. He's on a very low income, mainly paid under the table in cash, which is problematic because this whole program is very closely linked to your income tax return, the importance of filing your income tax. And a third thing, Louise Holland says she's hearing stories about concerns, the CDCP not paying enough, not enough and denying people crowns with no explanations. What is the best way to appeal? So let's tackle those three. So the role of hygienists, somebody who doesn't have a very good income and doesn't necessarily file, and then people who are being turned down for the kind of care that they want.
For sure. So with respect to the person in, I think it was a long-term care setting or some sort of setting of that nature, that's hard to get out to see a private dentist. It is great that this program covers for independent hygienists to get out to the nearest, to help independent hygienists reach out to those underserved communities. And originally, one of the problems with the CDCP was that there was a wage parity. So the fees they paid out for independent hygienists who worked independent of a dentist-owned clinic was actually lower than it would be if a hygienist worked in a dentist-owned clinic. And this was something that the Canadian Dental Hygienists Association lobbied the government to ameliorate because it's a very, arbitrary, like, why would you pay them less for the same service? And it's actually something that they've made progress on, and the 2025 fee guide has actually corrected for that. So I was happy to see that. I think, with respect to one of the major shortcomings of the CDCP, as I said, it's not universal. I mean, that's a big one, but also the fact that it relies on private delivery, which is something that is hard for many people, like people in long-term care settings. But also, if you live in a rural community and you don't have a dentist in your community, I worked in rural Newfoundland for years, and patients would have to drive over 2 hours to get to me. And you could imagine that changes people's behavior of accessing dental care away from comprehensive care and more, putting out fires per se. And it's something that looking at alternative dental delivery models, like, for example, one that we saw in Saskatchewan in the 1970s and 80s, where they focused on using what are known as dental therapists, which are equivalent to the nurse practitioners of dentistry that can do services similar to dental hygienists, but also things like fillings and some other routine procedures, all at a fraction of the cost of a dentist. Was a very cost-effective way for this school-based dental program to meet the population's needs, particularly for underserviced communities. And I think, I wish the CDCP was bolder
Mm.
in trying to implement some of these other models in places like long-term care settings, schools, community health centers, because the private practice model very much is geared around what can make the most money per unit of chair time. And while the CDCP is going to make that a little better in the sense that some people will be able to get chair time when they wouldn't otherwise, it still fundamentally is going to focus on luxury and cosmetic services over, let's say, a child with a dental abscess. There still isn't that fundamental shift in triaging, although it is obviously an improvement and a step in the right direction. But if we're building off of it, I hope we can still make progress for especially those people in those other, because while they might be able to get a hygienist come out to them, they might need fillings done, they might need dentures, they might need other dental work as well. Um, and then the second question, basically the criteria for being eligible for the Canadian Dental Care Plan is that you have a net adjusted family income of less than $90,000 per year. You don't have access to private dental insurance, and also that you are a Canadian resident for tax filing purposes and that you filed your tax return. So those are criteria that do have to be met for you to become eligible for the program. I'm not sure if that meets this specific person's criteria. I do think we start seeing some problems with the Canadian Dental Care Plan, even though it is a massive step in the right direction, that we look at some of the arbitrary exclusions we see of people who aren't covered, which, I'm not sure if this individual is one or not, but one that I was reading in the CBC recently was, basically the program was always for people who didn't have insurance, but there was originally with the CDCP a question mark as to whether people with really poor private dental coverage could drop their plans and gain access to the CDCP. And this is a common problem for seniors who, when they retire, were often offered to continue receiving their workplace dental insurance, but often with reduced coverage and higher premiums. And the CBC recently highlighted a case where a senior was ineligible for the CDCP, even if she dropped her private coverage, even though her private coverage only covered 60% of up to a maximum of $750 per year. So 60% of that 750. And the cost for her dental extractions and complete dentures was $9,400. So it's clear that designing the program in this way was, the liberals siding with private health insurance companies over regular people and not letting them drop their private coverage to apply for the CDCP. And it's something that, I still think having that minority parliament for the NDP to potentially hold the liberals' feet to the fire could hopefully make progress on this issue in the future. But time will tell where that ends up. And with respect to the third question, I do know once the predetermination process was first opened up, there was a lot of rejections. I think part and parcel because people were adjusting as to how to fill out the predetermination process. I think Sun Life was dealing with, how do we deal with so many, because there was such a backlog of things everyone was trying to get through theirs all at once. And even the proroguing of Parliament, I don't think helped as far as, Parliament wasn't in session as far as allocating funds where they needed to be potentially. So I do know that there were some hiccups with respect to the prior authorization process at first, but it does seem like things are moving in the right direction and things have been it's learning how to do a new thing as far as like exactly how to apply um, for say coverage for crowns and things like that for a new program, but it does sound like things are moving in the right direction.
So my heart goes out to this guy that Louise Emery is talking about. This is a person, and I think we all know people in this situation who aren't, they're sort of half in the system, half out, and end up with terrible dental problems. It sounds like the solution, at least for now, for this guy, is for him to file an income tax return at the very least, and then take it from there, which is probably something he's reluctant to do, but that sounds like the first step. So moving through some of the other questions, and I would just invite you to jump on if you have a query. We'll try and whip through some of this. What about reapplying every year? Now, this is some of my friends are like, what the heck? I have to reapply every year? What is this nonsense? Why can't they just tie it to the CRA, to the tax returns, and we're done? Because it's not like many people's status is going to change, especially in this current economic environment. So that's one comment from Mary Findlay. Keith Lowe says he's fully supportive of a plan consistent with the Canada Health Act. So what kind of political roadmap would it take to go back to revive or keep going with the fight for fully comprehensive public oral health? And how do we push the model of the Canada Health Act, which is the chronic challenge that we face here at the Canadian Health Coalition? And Louise Holland, another question. The program should be universal. Meanwhile, the criteria that limits seniors with access to a private pension is an issue. Why are payments and premiums not affordable for all of those with access to a pension plan? So there's three more for you, Brandon.
For sure. So I was very disappointed to see that you had to reapply for the CDCP every year. That was something that it's going to result in more people falling through the cracks. It's just a headache. And to be honest with you, it's unnecessary. Um, yeah, when you file your tax returns, they know your net adjusted family income. So I don't really understand why they would do this. There's going to be a lot of people, particularly, I imagine, say seniors who might not be as tech savvy or, you know what I mean? Like they're going to find out the hard way by going to the dentist and not having any coverage when they thought they did.
Right.
And it's going to result in people falling through the cracks. I think it's just one of those things that the kind of nickel and diming people when they shouldn't. Can you remind me again the second question?
Sorry, just to go back up here. Keith Lowe asking, how can we push harder to get the NDP and hopefully some of the people in the Liberal Party too to come out in support of the principles of the Canada Health Act, which goes back to our touching on universality earlier on, I guess. And then the criteria that limits seniors with access to a private pension was the third thing.
For sure. And I think there's overlap between those two questions. And if we want to look at how we achieve the principles of the Canada Health Act with respect to dental care, we need to look at how we got universal health care here in the first place. And I think there's two main pathways with which this can happen. One of them is through, provincial leadership and having a strong progressive come to power in one of the provinces and taking the lead on this. And then hopefully that becomes something that's a bit of a benchmark that other provinces are pushed. If the province next to you is guaranteeing access to dental care and say prescription medications or something, it's something that it puts fire under the butts of politicians next door to follow suit, especially if we're able to also have progressives at the federal level. And historically speaking, this would need to be within a liberal NDP minority parliament to create some sort of federal cost sharing agreement where the funding from the federal government to the provinces is contingent on meeting certain criteria like the principles of the Canada Health Act. And one of the things I think would be good is also looking at, with respect to dental care, trying to even improve on the Canada Health Act in the sense that, there's a lot of places where you don't have a family doctor or things of that nature. And, if we're wanting to make improvements on that, there are, things that are known as dental deserts, basically places that have no dental workforce or a very inadequate dental workforce to meet the community's dental needs. And, if we want to make the provinces if they need to be held accountable to certain criteria, why wouldn't one of those criteria be that they need to set up one of those publicly owned dental clinic and a public delivery model in those communities to make sure that we're trying to make sure that there is the workforce needed there to meet that population's needs. As far as getting the NDP on board for this, I think it's trying to build momentum around this issue so that they see it as a political winner. I do think legacy wise, this is going to be one of the big staples as far as Jagmeet Singh's legacy goes. And as far as kind of this era of the NDP, if we look back on the previous minority parliaments that we've had, it's been something that a lot of like things like CERB through the COVID pandemic, a lot of the programs that we had in that respect were temporary and are gone away. Whereas this could be something that's long lasting and is very much something that changes people's lives, as you've mentioned, Anne. And it's something that I do think it's important for us to put in perspective where the Canadian Dental Care Plan brings us, because it is a major step in the right direction, but it is still not everything. Because like right before the CDCP came in, our rate of public dental spending as in comparison to our overall dental spending was only 6%, which is the second lowest amongst developed countries in the OECD, ranking even worse than the Americans at 10%, which is always a funny point of comparison. But this is an important metric because it shows the inequality in access to dental care in a system. And even with the CDCP, which is the largest investment in public dental care in Canadian history, our public dental spending rate will still be below the average of OECD countries. It'll be about 25%, which the average of OECD countries is about 31.5%, and still far behind countries like Germany and Japan that have public dental spending rates of 58% and 78% respectively. So while this is a huge step in the right direction, bringing public dental spending from about $1 billion per year to 4.5 to $5 billion. So it is a huge step in the right direction. But because our starting point is so poor, it's important we don't lose perspective, even for the next question of a senior who may or may not be eligible because of their private insurance through the. So you know what I mean. You can see here if we're going to about 25%, you know what I mean? That's still not enough to cover most, if not all of the population. Like we need way more than that and have a system that is more comparable to say Japan, where their public dental spending rate is 78%. And so there's that other 22% is still for, luxury and cosmetic services. And there's little co-payments here and there, which I'm not the biggest fan of, but still objectively speaking, their system works infinitely better than ours does. And while this is a step in the right direction, we still have a lot of work left to go. I do think, the leaving people who have private insurance out of this was specifically to not threaten the private insurance industry. And I do think that there was fear from dental associations as well that if more people are pushed onto the program by dropping their private coverage, that wouldn't coincide with increased funding for the program and it would result in worse coverage. But that being said, the Canada Revenue Agency has started tracking basically if you're receiving private insurance through your employer. So if people start dropping their plans to push people onto the CDCP, you can track which businesses are doing that now and then tax them on the back end to make sure that that the added funds are going to the program and it's not being done in a regressive way. So the companies that are dropping that are paying the bill for it.
I just wanted to mention I found an interesting statistic. Like during the leaders' debate, we heard Quebec, the representative of the Bloc Québécois, François Blanchet, saying, the dental care program was an intrusion into the jurisdiction of the province. And we hear that argument made that healthcare is provincial and that these are intrusions. There are 1.1 million Quebecers approved for the Canadian Dental Care Plan, and the population of the province is about 7.5 or 8 million. So that's a lot of Quebecers who want in. 1.2 million in Ontario and 200,000 in Alberta. So all that talk about provincial and territorial jurisdiction aside, a lot of people want access to this program because their provinces are not moving on it. I wanted to address a question, sort of first principle question from Charlene Cunningham. She says, I agree with the concept of dental being included. How do we as a country support it? Which is often a question we hear, sort of this austerity kind of culture of the political environment we're in, which is that we can't afford these programs. So I wonder if you could just tackle it from very basic first principles, Brandon.
For sure. I think it's really important with respect to this person's comment that we remember that when universal health care was first brought up, that it was framed as unachievable, too lofty, pie in the sky. But what is seen as reasonable is subject to change depending on what people like you and I do about it. So us being able to build up people's confidence so that they expect more from our government, and that comes through, collective groups and banding together and building momentum around these issues, supporting organizations like the Canadian Health Coalition, uh, you know, joining, like helping unionize your workplace. All of these things help breed a sense of collective consciousness in class awareness where people can, a lot of regular people are conditioned to work against their own self-interest and support policies that benefit the rich rather than themselves. And if we can help people come to terms with the fact that the status quo of politics here in Canada delivers those results. We saw in the first 2 years after the COVID pandemic start, billionaires added over $100 billion to their wealth, while regular people were worse off. So helping people come to terms with the status quo of our politics and raising awareness around that, I think would go a long way towards helping political movements that are trying to address these issues. So I think, us educating people, us holding events like this, building that collective power is really what's needed. And what will result in the NDP or parties like that looking at issues like this and seeing it as a political win. Because I know speaking with Don Davies from the federal NDP and the previous health critic, current finance critic, has said he was amazed to see how energized people got around public dental care because it's such a tangible issue in people's lives where they live with chronic pain. They live with missing front teeth and visible decay or dentures that don't fit that's been there for 30 years. And it's something that it's such a tangible thing that you can help improve people's quality of life. And if they believe that that's possible, they get very excited and they actually want to engage with politics because that's a big thing with the status quo being so bad. People feel disaffected and they disengage from politics. So giving them something that actively motivates them and makes them want to be part of it. I will say as well, I do find when I speak with people, speaking with them about that public delivery dental therapy model is something that I find gets people really excited, because one of the questions people ask when it comes to public dental care is, the cost associated with it. And part of what that boils down to is, why does a filling cost $250 or $300? And you know what I mean? There's a level of like dental equipment is expensive. And if we want to address some of these issues, we shouldn't be having dental students graduate with $275,000 in debt and things of that. We need to deal with those issues as well. But also at the same time, that dental therapy model fundamentally breaks the dentist centered private practice model that drives up costs at rates higher than inflation. So we could look at something that it's like, well, why don't we have dental therapists who would be willing to do fillings maybe at half the cost of a dentist, which would make our tax dollars go much further. We could have a better public dental program, focus more on prevention, and meet people's needs much better. And when dentists are in particularly communities that don't have the workforce to meet their need, when a dentist is there, they can focus on higher end procedures like root canals, crowns, and stuff like that, because all of the fillings and cavities have been dealt with. So I find that to be something that really excites people.
So just to pick up on a comment that was made earlier, if you get turned down for the crown, that seems like the best solution. Is there an appeal process, Brandon? Is there some way that you can come back at it?
Yeah, yeah, there is an appeals process. It's similar to how that works with other private insurance companies. I think the thing that's really important is in the predetermination process, there's very specific criteria that they want to make sure that this would be eligible for the program. I think they include things like the probing of the gums to make sure that there's not extensive gum disease on the tooth. So like the crown to root ratio, you don't want to be investing in a crown on a tooth that is barely holding on by a thread, and you know what I mean, it's very loose or something like that. So just making sure that all of those criteria are included should give you the best chance of being approved the first time. And you know what I mean? If you do have to amend it, just making sure in that second time that you explain and have all of that information included.
A couple of questions on dentists. Diane Wood is saying there's a problem with dentists taking only present patients, but no new patients. I noticed in some of the reporting that 24,800 oral care providers are now signed up to the program of about 30,500 who could sign up. And initially, when the program was introduced, we heard a lot of fussing and, dentists not liking it, not willing to sign on. That's proven to not actually have been the case. I mean, I see signs up in front of dental offices all over Montreal saying we are, providing care under the CDCP. So I wonder if you could just address how you feel about the participation of your colleagues.
For sure. When the program first came up, I will say there was a lot of misinformation being spread to dentists and amongst the dental community about how this program was going to be overly burdensome. It was going to be very harmful to dental clinics. And what I wanted my editorial focus to be on was to frame to dentists this being a mutual win win for both patients and providers. Really, dentists are getting everything that they want with this program with respect to, a lot of the existing provincial dental programs pay about half of what the provincial fee guide suggests. Keep in mind, dentists set the fee guide, so they often set it above inflation each year. But the CDCP fee guide here, in comparison to the Nova Scotia fee guide, is 88.6%. So this is a much more, the federal government showing a good faith effort that they're trying to remunerate dentists in a fair rate. And dentists are even allowed to charge above and beyond the CDCP fee guide. So there's no loss there. Um, and I think we've seen a massive uptick in dentists who have taken up this program. There's still problems because you can imagine if it's not everyone taking it, and if you live in a rural community and the only person doesn't take it, you're out of luck there. Um, and the problem with respect to clinics not taking new patients, I mean, there's going to be a bit of a learning or a bit of a growing period for this program, because there are clinics that are being inundated with more dental work, particularly considering the CDCP resulted in, a lot of people haven't been able to see a dentist in many years.
Mm.
And you know what I mean? There's a lot of backlog of work that needs to be done. So if a clinic is going to take on these new patients, they need to feel like they have the capacity to do that. There's a lot of places that do have that capacity, particularly in more urban areas, because the dentist per capita ratio there is much higher, which results in more free chair time to offer to people to fill up with these new clients. But in many rural areas, there's understaffing and difficulties there. But these are ongoing issues that have always been there. They were there before the CDCP and should not get in the way of us implementing the new CDCP. I think it's just going to take time. And it's one of those things that we can't view the CDCP as our end goal because, for example, one of the big things that the dental associations run by dentists have been pushing is that we need thousands of more dental assistants and dental hygienists. And while that, there is to some extent benefit to that, what we're missing there is the root cause of how private dental clinics don't pay these workers enough to justify staying in this career their whole life. So we see a lot of, for example, dental assistants who graduate, come work for a few years, and realize that they can't earn enough to, they can't make a living in this. So looking at, say, the unionization of the dental workforce so that they have better working conditions is going to result in less attrition and less people leaving these professions and result in, more dental assistants, more dental hygienists. And it's something the government is giving $4.4 billion a year towards dental care. Those workers deserve a chunk of that. They're doing the work too, not just dentists. So it's something that, while having more dental assistants and dental hygienists trained is good, I feel a level of cynicism from the dental associations that are just wanting to do that to undermine the existing labor market so that they don't have to pay those workers better. So I think, we may need more of those, but also having things like dental therapy, as I said, become mainstream would result in greatly increasing the dental workforce so that these people they don't just have coverage, they have a provider as well.
Really good question from an anonymous attendee who has an adult daughter with disabilities. And, many of us have kids who have various forms of special needs. She didn't know how to apply for the CDCP. Her care providers didn't follow through. What about families whose children with disabilities find it very difficult to access the program? And it amounts to a form of discrimination
Totally.
toward the people among us who are, disabled in various ways, and it makes things difficult for the families. And here's another sort of difficult scenario put forward by Jeanette Pongratz Doyle, who says her husband and her have both been told they're eligible, but he isn't eligible until he retires. He's got a lot of expensive medication that he takes, and outside insurance companies don't accept. Anyway, it's a complicated situation. So basically, she says, is he going to have to work until he dies just so we have some kind of coverage? A scary future for us. And I don't think Jeanette von Gratz Doyle is alone in facing that kind of limitation. So that's question number 2. And then I just go down a little bit further and see, somebody says happy National Dental Therapists Week. I didn't know it was Dental Therapists Week. But I take your point about the working conditions. I see this wonderful woman who does the cleaning at my place, and she works really hard. She's on her feet all day. I agree with you. I think better working conditions would be good for all of us. One last question. Let's just take those two, actually. Sorry, Brandon. Let's just take those two. Complicated medical files and disabled people who have difficulty accessing the program.
Sounds good. So currently, people need a valid disability tax credit at the federal level in order to apply within the program for being somebody with a disability. With the last phase of the program opening up, I mean, it will still be helpful to have that, but also at the same time, it'll just be if you're within the age group and fall below the income threshold, you can apply on that basis. Um, so you know what I mean? Like say somebody who's 25 at the moment and has a valid disability tax credit, they can apply. But if they didn't have that valid disability tax credit, they couldn't at the moment. But once we get into May, people who are 25, regardless of whether they have a disability, can apply for the program. So there will be some simplification there, but also at the same time, I do think it's important to talk about the private practice dentist centered model of the Canadian dental care plan that it relies on. Because with the private practice model, they're focused on making the most money they can per unit of chair time. And people who have a disability are often discriminated against in this setting because they have more complex medical needs and often take more time to treat. Meaning that, say, if I'm treating a child with autism, it might take me 2 or 3 times as long to get through a filling, which means that even if they have coverage, I could make much more money by treating somebody who didn't have those special needs because I could get through more work per unit of time, which is why I really like focusing on that public delivery model that I mentioned, which is more focused on salaried employees rather than paying people on a fee for service basis, which removes that incentive to, churn out patients left and right and creates a more equitable system, and also removes the incentive for overtreatment because, with the fee for service model, if one dentist finds 5 fillings and another finds one, there's a level of trust you need to have with your provider to know who's telling the truth. And with the fee for service model, there is the incentive created for overtreatment. And we also see the increasing corporate takeover of dental clinics, driving the profit driven model even more. So it's something that, looking at the CDCP is just a stepping stone. I hope we can make more progress on this issue, even if it's better than it was before. It's like being the tallest kid in kindergarten, and, we can strive for more than that. And the other person as well who currently is relying on their workplace insurance for their drug plan and are wondering when they retire. I mean, those are very serious issues that people need to contend with. I don't want to speak on what's the right decision for you as an individual, but also at the same time, it shows the absurdity of our current reliance on workplace insurance and having these exclusion criteria for people and not having universal programs. And that was something that I feel like the window of opportunity for the CDCP, part of the thing that helped galvanize and create the momentum around this was the financial hardship caused by the COVID-19 pandemic, where so many people became unemployed while also at the same time, becoming unemployed, losing disposable income, but also losing your drug coverage and dental coverage, which created this sense of, a lot of people lack access to dental insurance already. But I feel like the COVID pandemic and that happening to so many more people, it reached a critical mass where people felt like something had to happen there. And it's still with this program, we still have the questions like the person mentioned, but it's moving in a direction where hopefully we can get so that people have dental insurance unconditionally. There's no, oh, do I wait to retire? Do I not? And this is something that I think progressives should be focusing on with their message of this is freedom. Freedom to not worry about losing my drug coverage, my dental coverage because of I lose my job, or maybe I want to start a new business or whatever it might be. Like, you don't have to worry about losing your coverage there. We have the freedom to know that even if we're unemployed and we get a heart attack, we're not going to go bankrupt for medical bills. We're looked after there. And I do think that that's something with dental care we should be focusing on as well. And it's going to result in much better outcomes because when people neglect their oral health when they're uninsured, they leave, preventative services and early intervention end up on the back burner. And people end up trying to play catch up later on once they do get insurance. So, things end up getting worse. You lose more teeth, you get gum disease. And if we look at a place like Japan, for example, that I mentioned earlier, that does a much better job than we do, basically they have what's called the 80-20 initiative, where they try to support initiatives where it helps people who are 80 and above keep at least 20 or more of their own teeth, which they use as the metrics to view the long-term success of their dental care system. And before they included dental care in their healthcare system, only 7% of people who are 80 or older had 20 or more of their own teeth. And now we're at over 50%. So we can see the radical improvement in people's quality of life when it comes to having a more comprehensive dental care system. And it can lower costs overall. As we said as well, the US spends way more on healthcare than we do. and delivering worse results because, there's all these private middlemen trying to, get their hand in the pot there.
80/20, that's something for us to aim for. I'll have to
Yeah.
keep that in the back of my mind. And now we're seeing, because of the tariff war, layoffs in places where people have coverage, like at Stellantis, for example. So what does this mean for people? Like a bit like during the pandemic, people are going to be losing their private coverage because of jobs being put on hold or lost because of the tariff war. I wonder how you see that in the picture.
Oh, totally. And that just further shows the absurdity of relying on workplace insurance. And even like it's not a reliable system, particularly considering our economic system tends to have crashes every, 7 to 10
5 to
years.
7 years.
Yeah.
Yeah. Yeah.
And it's something that, you're going to have a bunch of people losing coverage. And you're also going to have people, it's like, well, if somebody worked 7 months out of the year and then lost their job, but they made just over the income threshold as a family, but are unemployed now, but their previous year's tax return is just over the limit, but now they're unemployed this year. And they don't, you know what I mean? There's going to be all of these people who nominally should, like in theory, should gain access to the program because of the absurdity of the selection criteria, are going to leave people out. And it's one of those things that I understand they had to draw lines, but I think we should be looking at expanding that and moving towards more universal approach, especially like keep in mind the people who make between 70 and $90,000 per year have either a 40 or 60% copayment, and balance billing on top of that adds another 15%. So you're looking at people in you're trying to make trying to get by off of 70 to $90,000 per year as a family of four. So that's still not that's still a hard thing to do. And for those people to have to pay over half of their dental bill, realistically speaking, like how much help are we really giving to those people? Because they're not going to be able to use their coverage a lot of times. It's going to be used to maybe extract a tooth, but it's not going to be for comprehensive care for most people.
I just wanted to answer somebody in the Q&A who says that they can't see the links. Just to remind you that the links to the Coalition for Dental Care on Facebook and on Instagram are in the chat. So just go over to the chat from the Q&A, and also information about getting Brandon's book on dental care, which I think may be the best way to get an overview of the whole picture of dental care and the importance of the lobby groups and the push for privatization. And also, you mentioned earlier the trend for companies to be buying up dental practices and corporatizing the practice of dentistry. I just wanted to close on that that element of the picture, which I wonder how you see that connecting to the program, the fact that corporations are buying not one, not two, but 3, 4, 5. When dentists retire, younger dentists can't afford to buy the practices. These companies are buying them up. And just one last point, you can follow that. We've just put in a reminder of how to follow Brandon on the social media. So let's just close with that because we've come up against the clock, Brandon.
Awesome. Well, thank you for having me, Anne. I always enjoy when our paths cross, and I'm looking forward to working again.
Sorry, I was just asking you one last question though.
Oh, for sure. Sorry.
Sorry, the corporatization of dentistry,
Oh,
like
for
how
sure.
does that, like, it seems to me that's like,
Oh,
there's
totally.
butting
And
of heads there.
that's something that this CDCP program can, to some extent, be viewed as a public-private partnership because it is funneling money to a lot of these dental corporations that underpay their workers. And, it is a very big trend. Funny enough, I actually looked up the other day how much dental school is costing for students now that I've been out of school for about 6 years. And the first year of dental school here at Dalhousie for a Canadian citizen was $58,000.
Wow.
So students are graduating with, $275,000 in debt, and they're hesitant to be taking on new debt to buy a dental clinic for a while because of how much debt they're already in. And this has created a window of opportunity for a lot of, seniors who are older dentists who are looking to sell their clinics. The only offers they're getting are from these dental corporations that are buying up hundreds and hundreds of dental clinics And they, the younger dentists have no option but to go work for these people where they can earn, a reliable source of income because they don't have they don't want to take on an extra half a million to $1 million in debt to buy a clinic. It's something that addressing those issues are very important. The corporate takeover of dental clinics is very much at the heart of what we're talking about here. Where do we want to look at dental care as healthcare, or do we want to look at it as a private service where we're focused on what can make the most money per unit of time? This also, they have the ability, they have the incentive. A corporation doesn't know how many cavities are needed. They see a number on a graph, and if they can incentivize for dentists to be a little more heavy-handed in diagnosing, you know diagnosing 5 cavities instead of 3, or kind of fudging those middle lines there, and putting their thumb on the scale, it does result in line going up on graph, which is all they care about. And it's something that it further shifts dentistry away from healthcare and towards this money-making machine, which is fundamentally opposed to what we at the coalition are working for. And I think if we really had a bold progressive agenda, what we would be talking about is nationalizing these dental corporations and turning them into those public delivery models, um, to rapidly expand that public delivery network. But I won't hold my breath. But
Meanwhile, we continue to work on this, and I wanted to say a big thanks to you, Brandon, for coming on again, and we'll do some more about healthcare with teeth, which has become an ongoing theme in our webinar series. And a big thanks to all of you for joining us today and for caring about this issue and for helping us to pursue the struggle for universal public health care in its various forms, including covering our mouths and our teeth. So thank you very much to Tracy Glynn for managing behind the scenes. Thanks to the board and members of the Canadian Health Coalition. Big thanks to Brandon Doucet, and a big thanks to all of you who've joined us today. Just be on standby. We'll undoubtedly get back to this and other issues in our ongoing webinar coverage. And don't forget, I know I don't have to tell you this, of course, but the election's on the 28th, and I think the advance polls have now closed. So do exercise your right to suffrage. Thanks to everybody. Take care.
thanks for having me.
Bye-bye.